It's Amazing Friday because we have got Professor Duncan Lascelles here. Now, any vet in the UK will be going, oh my God, how did she pull that off? So all the public, this is a big deal. Okay, so just sit pretty and listen, because I think I emailed you probably a couple of years ago. So this is massive for me. Please introduce yourself. Tell them who you are, what you do, so they can be amazed as I am.
Sure. Well, hello and good Friday to everyone. So I'm Duncan, and you can probably tell by my accent that I am British, and I grew up in Britain, went to vet school at Bristol, did my training for further training at Bristol, and then Cambridge University, where I trained as a small animal surgeon. So I'm trained as a small animal surgeon. There we are. But since about the year 2000, I've been working in the United States. Most of that time spent at North Carolina State University, which, if you don't know where North Carolina is, everyone knows where New York is. Everyone knows where Florida is. North Carolina is on the East Coast, halfway between those two. Just draw a line between those two, halfway down, that's North Carolina. And I live in Chapel Hill. It's sort of in the center of North Carolina. And I work at the vet school, which is in Raleigh, about 30 miles away. And what I do there is I still work as a surgeon, but I spend most of my time engaged in pain research, and particularly clinical pain research. So what I do is I work out ways to measure pain, and then I use those methods to determine what works to alleviate pain, whether we're looking at diets or supplements or drugs we currently have, but we don't really know or understand too much about how they work, or drugs that we may have in the future, or even drugs that are destined for human clinical trials. So, and maybe we can come to this later, but pets are a great model of human diseases.
Yeah.
So, looking at what works and what doesn't work in pets can both inform human medicine, and the benefit to veterinary medicine is we learn more about what works or doesn't work in our pets. So that's me.
Yeah, that's just not you. There's a lot more to you, because you, as you say, you also are still doing surgery as well. So you're still on the front line. You're not hidden from the public. You're still dealing with people, which is a really big, feather in your cap.
Yeah, and I think that's, so I do a lot of research. And whenever anyone uses the word research, they think of someone locked away in a lab and divorced from reality somewhat, particularly if you're in university. People may have heard the term ivory tower. Oh, you're in the university in this ivory tower. Well, I try and be the opposite of that. I am in a university. I do a lot of research, but I want that research to be applicable and relevant. In order for it to be applicable and relevant, I need to know what's going on and what the problems are. So I really do focus on keeping a connection with the clients, the general public, the pet-owning public, and understanding what their concerns are, what their needs are, as well as understanding how treatments for pain are being used and managed within the practice setting.
Yeah, no, and I think that's really important, because I think we need to know how the public perceive what we're doing to get them to trust what we're doing. And I think that, as you say, is really, really important. We've got so much to talk about tonight. We're going to start, I think, with the research. Let's go there first and just tell us a few things that you're up to. And then we're going to go into put you on the spotlight and give you a case. We're going to do a mystery case. And then we're going to drift into your work with the objective monitoring, etc. And then we're going to, where should we go after that? Because there's so much. Oh, young dogs. We
should definitely talk about young dogs, yes.
We're going to talk about young dogs. And if we get time, we might do another mystery case, and then we're going to do 10 top tips. So tell us about the sort of research that you're doing at the moment. What projects have you got on the go?
Yeah, so usually we have cat and dog projects going on. As I say, these are people's pets. And so most of the trials that I run at the moment are around osteoarthritis in dogs and cats, as well as some work in cancer pain. And so what we do, depending on the particular therapeutic that we are looking at, and that could be a supplement, it could be a diet, it could be a drug, or a biologic drug.
Yeah.
And that could be given by different routes. It could be given to the whole animal. It could be given into just one joint. Depending on what we're looking at, we then recruit a certain population, or what I call a phenotype. And a phenotype is just a fancy term for what that animal is showing in terms of the degree of pain, the type of pain, the level of pain, where the pain's coming from. So we recruit particular animals in order to understand how a particular therapeutic is working or not working. And so we use Facebook, we use Twitter, we use all sorts of social media.
Central for people to get to, because are you in a part of the country where people will kind of migrate to quite easily then?
Sort of. There are about 1 million, maybe just over 1 million people within about a 30-mile radius. So
do they all have amazingly well-kept arthritic dogs?
Yes, they all have arthritic dogs, which is perfect. No, so we've been pretty lucky. We've been able to recruit fairly easily to both cat and dog studies. And then what happens is, and so these studies are set up so there's no cost to people enrolling. And so we see clients with their pets, we examine the pets, we determine what's going on, and not every pet is right for the trial that we have going on. But anyone who comes in, we're going to, give them an examination, probably run some blood work, and then those pets that do fit for that particular trial, and then they move on and they'll run through the study, which could be 3, 6, 9, 12 weeks or longer, again, depending on what we're looking at. For example, if we're looking at a drug that has a fairly quick onset of action, then the study need only be 2-3 weeks long for each animal. But say we're looking at a diet or a supplement, well, our current understanding is that those things take longer for us to see the benefit.
Yeah.
So a diet study may well be 8 or 12 weeks long.
Yeah.
And during that time, whether it's 2 weeks, 12 weeks, at intervals, we have the owner come back with their pet and we collect data. And so what sort of data do we collect? Well, we use...
You've got some cool tools as well, haven't you?
Sorry?
So you've got cool gear that people that go to their vets won't see, don't you? So
right.
Yeah.
Right. We do have some very cool gear. Yes. I'll come to that in just a second. But it's not all about the cool gear. So just as I try and keep in contact with what the needs are in veterinary practice, we make sure that every time we run a study, we use assessments that can be used in general practice.
Okay.
Assessments that can be used by, everyone who's watching, your veterinarian. And actually, we develop tools that can be used by your veterinarian, that are designed to be used by your veterinarian. Most of those are around questionnaires. And there's a whole science around this, the types of questions you ask, how you ask them, the number of choices, and so on and so forth. So we use everything from those questionnaires that we ask owners to complete, right the way through to some of our fancy tools. We'll test sensitivity of pets in different areas. We'll measure limb use using force plates, pressure-sensitive walkways. We'll capture video data and analyze that. We'll use accelerometers, things like Fitbits. Not Fitbits, but kind of doggy versions of Fitbits or cat versions of Fitbits, to look at not only total movement, but how animals move. We'll measure the quality of sleep. We can measure cognitive function, essentially, how bright your pet is and how that changes with pain management. So really what we're doing is we're using all the methods we have to measure all the dimensions, the things that pain impacts.
Yeah.
And so if you think about it, if you have pain yourself, you'll find that you maybe don't sleep as well.
Yeah.
So that is a measure. It's a surrogate measure of pain. If you have knee pain, you'll find that you're limping or not using your limb as much, not able to move around as much, not able to climb stairs as well.
Which
so
is quite
the same things.
There are so many things that we can observe and measure that sadly in first opinion practice, the nature of the way that we have to work, nothing tends to get measured, which is daft, really.
Well, yes, and I think yes. So a big push of mine in the last few years has been to try and get the tools that we have developed that can be used by practitioners, by your veterinarians, into their hands and get them using it. And that hasn't been easy, but we keep pushing for that. At the same time, I'm very interested in developing, if you like, higher tech tools that are very easy to apply in a practice situation.
Yeah.
And
I think in defense of vets, because I'm a bit bipolar. I'm a first opinion vet, and I can understand the difficulties when people come in with new ideas of new things they want you to add to your workload, as well as phoning Mrs. Smith, doing a blood report, seeing this dog, extra consult. Oh, you want me to now do some more paperwork? Brilliant, thanks. Right. So I can see that side of it, but I do get frustrated that we objectively measure so many other things, like TPR, diabetes. We're more likely to do, plaque and gingivitis scoring than we are chronic pain scoring. So that I'm a bit bipolar about it. So what CAM's trying to do, guys, so all people that are listening, is we want you to take the lead and go in and go, I would like to measure my dog's pain. I would like to know more detail, because I understand that I can be swayed. I can understand that I can be biased by my own emotions. So, hey, I've heard about this. Can we use it? And then for us vets that go, brilliant, I don't have to have that difficult conversation. They're on board already. Because when you've got 15 minutes, spending 3 to 4 of them trying to persuade someone of the importance of this new piece of paper tool, they'll be like, right, okay, great. Can you get on with treating my dog? So that's what the plan is behind CAM.
Yeah, and you're doing a great job of that. And we do all need to remember that any tool has to fit into the workflow. And that's why I really do like to keep connecting with what's going on in practice, and practice myself, because then I fully understand how, if I'm going to add anything in, it has to be a seamless part of the workflow.
Yeah, definitely.
But I think the other part of this is, and we were going to touch on this later maybe, but I don't think as a profession we are always comfortable talking about pain.
Let's do it. Let's go. While we're there, we can jump around a lot.
All right. Well, let's talk about osteoarthritis in dogs. Yeah. So whenever, and this is like a word association game, okay, to all your listeners, if I say osteoarthritis in dogs, what is the next word you're thinking of? And I actually know the next word you're thinking of. I can guarantee somewhere in there was old.
Yeah, very
okay. So when I say osteoarthritis in dogs, everyone thinks old. Well, here's the reason for that is that osteoarthritis in people is an old person disease. So the older you get, the more likely you are to have osteoarthritis, and the more likely you are to have pain from that. And then superimposed on that is how you live your lifestyle. Say, if you're a skier, you're a little bit more likely to have osteoarthritis. If you're a bad skier, you're much more likely to have osteoarthritis. Okay, so it's an old person disease with a superimposition of how you live your life, how you use and abuse your body. That's people. And because that's so ingrained, because we know that so well, we then transfer that to dogs and cats. And so we think of osteoarthritis as an old dog disease. But in dogs, it's very different. Osteoarthritis in dogs is driven by developmental disease, which is really common. And we can talk about what these are later, but elbow dysplasia, early age cruciate ligament disease, and so on. So it's driven by developmental disease. That means osteoarthritis is initiated early in life. It is a young dog disease. The pain is there. Dogs can still manage to do their activities, but they're coping. And as the pain gets worse, they continue to cope, and then later on in life, they just can't cope anymore. So when we see these dogs later on in life, when they're not able to jump in the car, they're not able to climb the stairs, that's when things are really bad. That wasn't the start of osteoarthritis.
Thank you for saying that, because this is something that I get really a little bit hot under the collar about this, in that people will assume that once they start seeing their dog not being able, that, oh, it must be the start of the pain journey, and therefore they pursue less impactful interventions. So they'll avoid medication and they'll try supplements first, because it's the start of the pain journey, thinking that it crescendos. They haven't got it on board that actually the dog's in a lot of pain by that point.
Yeah, exactly.
It's a woo-ha!
Yeah. I know. When we see a dog unable to do something, that's really bad.
That's pretty bad.
We should have been looking carefully earlier on, which comes back to where we started this. We don't like to have conversations about pain. Who, as a veterinarian, wants to have a conversation with an owner of a young dog about the fact that maybe osteoarthritis? Because historically, we framed that as a very depressing conversation.
Yeah.
30 years ago, I was having those conversations. Oh, I'm sorry. Your pet has osteoarthritis. It's a lifelong, incurable disease associated with pain. I mean, that's depressing. No one wants to have that. What we should be saying is, thank you for coming in. I am so glad I've caught this, because we can change your pet's future. If you act now, we'll change your pet's future. If we wait 6-7 years, we're not going to be able to do much.
You know what? You're my brother from another mother. That was in a slide that I did recently, which was, there was a picture of a dog's foot, and you could see that it's got arthritic change across the interphalangeal joints. And there was one speech bubble saying, we need to leave this, which is, oh, it's okay, it's just a bit of arthritis.
Right.
Change the way that we talk to people and say, this is arthritis. We need to actually start doing something about this now, so that we're sure that we keep control of it and get your dog the best quality of life for as long as possible. And it does come from the vet profession having to be brave and say that. And it's not easy, because I said
it's not easy.
No, I had a lady who she's quite a young dog, and she in her head had the pictures of hiking and mountain biking with her dog, and all of these things that she had, this Weimaraner, this athletic, we're going to cover some miles. And so when I turned and said, well, no, actually he's got really quite sore elbows, and looking at breed, age, this is going to be a dysplasia, and this is going to be so, doesn't want to know, complete denial initially. And I think we need further training as vets of how to stay there, stick with it, bear it, and keep going, because they do come back if we keep the same kind of support service and structure and be there for them. But I think we do find it quite difficult to have that conversation. Is that fair to say?
No, I think you're absolutely right. It is difficult to have that conversation, and you're basically saying, look, this is going to be, we're going to have to be constantly working on this. This is a lifelong thing. But I think if we can frame that conversation, as veterinarians, frame that conversation in an optimistic way, and quite appropriately so, because if you catch something early, that's got to be more optimistic than trying to treat it later on.
Oh, yeah.
And so we just, repackaging the conversation in a different way.
Definitely. I think another thing that was brought to my attention by a vet at one of the courses we did was, he said, well, I've caught it early, so what do you want me to do then? And you could see, and I think actually he's right. When we get taught about this disease, we don't get taught how to manage it long term in a young dog, where we really are trying to say, right, we want to avoid medication if we can. We're going to use it when we need it. We're going to, have our boxes. But that teaching isn't there. And whether we like it or not, owners come in to vet practice and they pass their 35, 40 quid over, and they do want an entity. They want something to hold, to walk away with. They don't like coming in just for advice. And if you said, right, okay, so I'd like you to do these exercises on a walk. I want your dog to be up and moving. They're like, it's £45 for that.
Right.
Where's my thing? Where's my thing?
Yeah.
I think there's definitely a void of teaching. There's a, hey guys, there's a void of teaching that we need to fulfill. of what do we do when they maybe don't need surgery, and and they don't need medication. They're in that zone. That's a very difficult zone to help people as a vet with minutes.
Yeah, and I think it's important for us to figure out how to most appropriately communicate that and help owners when they're in that situation. I think one other point that I want to make here, because you mentioned medication. So I've just said it's a young dog disease, and medications can be really helpful to help the pain. But something that I've done a lot of research on, and I talk about a lot, is the fact that medication does not necessarily have to be lifelong.
Yes.
And I think that's something which we've all, as veterinarians, we've all got to try and understand and communicate that to owners. That said, very often we need to use medications for several months at a time to improve the situation, to get everything back on track. Then we decrease them, stop them. And my experience is that in the vast majority of cases, you can be without medication for years and years. You use those tools early on, fairly aggressively, as a treatment package. And I think that's, maybe you talked about, well, what do owners get that's tangible when they come in? Well, we need to present that in a way that, hey, this is a treatment package. Here is a prescription for exercise. I'm writing it out for you. This is your training plan. For years, I used to say to owners, well, go home and gradually increase your pet's exercise. I mean, what the heck does that mean? What is it exactly?
Yeah.
Any
does that mean?
Yeah. Anyone who took me seriously would have gone home and done a Google search, gradually increasing exercise, and they would have come up with a training plan. And so that's what I started providing. There's a training plan tailored to the individual patient.
Do you have that? Because I was actually daydreaming, what with this whole isolation thing. Online at the moment, the people that are making the money are the exercise online plans. There's beach ball, beach bum, beach chest. Come on, guys, let's get bikini ready. Not that we're going to have a summer. And but they have structure, and they have video clips, and they have a progression. And I was just like, God, wouldn't that be just amazing if people came in and the entity that they took away, the package, was actually to be put into a club that had some monitoring, which we're going to talk about, and could progress through a series of kind of exercises, and they were given snippets of advice coming in from all angles. So there was nutritional advice and there was motivational advice. That would be insane. Instead of just, as you say, those echoey words of little and often and slowly progress the level of intensity.
Right. Exactly. Right. Because what does that mean, really?
What does that? So tell us about. Yeah, no, Karen.
No, sorry, I've lost the thought now.
What you're up to, because that's how we made contact. Because I saw you on LinkedIn talking about your new.
Yes.
You've got going, and that fits in nicely. It follows well from here.
Yeah, so something that I've been interested in for a long time now is activity monitors, and my interest in them was because of my interest in activity and movement and the health benefits of that, and also how pain negatively impacts that. So a few years ago, I thought, you know what, I've been measuring total amount of activity. And it's really difficult to pick up treatment effects, when I've been running my studies. And I thought, why don't we look at the quality of movement, how you move? Because yes, how much you move is important to a degree, but the differences between individual humans in how much they move. The difference is within one individual, how much they move from one day to the next, 1 week to the next, is huge. But what is constant is how you move. So if you maybe just think of two scenarios. Think about a teenager human. You see them moving around. They get up out of their chair effortlessly and almost just glide across the room, twist, turn, stoop down, get back up, back to the chair. Now, you ask me to do that. Well, I'm gonna, I've got to help myself up. The first few steps are going to be really uneven and stilted. and eventually I get across the other side of the room, and I'm certainly not bending down with any ease. I mean, I'm exaggerating a little bit, but what I'm trying to say is that,
I hope so.
you know, when you add pain into the mix, your quality of movement deteriorates. So combining that interest and that idea with the idea of trying to put into practice and into owners' hands tools that can give a useful readout. Myself and some colleagues, we started a little company called Anivate. And our first product is the methodology for measuring the quality of movement. And so the idea here is to add this into either existing activity monitors or produce our own activity monitor and get a readout of quality of movement. And what that is going to be able to do is detect early onset of pain, which is a big focus of mine, early onset of pain as quality of movement decreases, but also give owners a almost instant readout of how effective treatments are.
Yes.
And that's something, you know, that we, and you know this, we struggle with this as veterinarians. We know what treatments work on a group basis.
Yeah.
You know, and so we prescribe that treatment, but you don't always know that the individual is going to benefit. You know, one individual may benefit better from one therapy versus another. And so having something that can give that almost instant readout of whether or not that benefit is being seen is really important. And that's going to be important for veterinarians and owners. So that's what Anivate is all about.
So what's it kind of, is it measuring, how does it measure? Is it like detecting wobbles and imbalance and sudden movement, which, what?
Yes. All of that.
Excellent.
You just it's the quality of movement. It's yeah. So exactly, it's measuring all of that. You know, very high tech data analytics, but it's measuring the quality of movement. And we all know what poor quality of movement is and what good quality of movement is.
Yeah.
And I mean, just think about if you've had pain anywhere in your body.
Yeah.
And you go to move that body part, the movement has stopped before your brain is even almost aware of it. You know,
yes.
pain has a very strong impact on how you move.
Yeah.
And so that's what we're measuring, is the impact of pain on movement.
So what about for these situations where people say that it's come on quite slowly? So that's a very common phrase where people are like, oh, I just really didn't notice any change because I see him every day. Do you, your tool, is it going to be able to grade over time? So it'd be like, well, this was a month ago, look at the difference, you know, so is it a time thing as well?
Yeah, so the great thing about our approach is that it gives a real readout. It doesn't need to be on the animal or measuring something for a period of time to say, okay, things have changed. You can get an instant readout. Movement, quality of movement is not good or it's good. Yeah. But I think this is going to help a great deal with the problem that you just mentioned. So anytime things happen slowly, it's very difficult to actually see them, to notice them, because they happen so slowly.
Yeah.
And factored in on top of that is that our pets, dogs, they want to please us. Mm-hmm. All the time they want to please us. And so they are trying to cover up. They're trying to pretend everything's normal when it's not. You know?
I had a dog in today, oh my God, and it was a black lab, about 8-9 years old, and proprioceptive deficits in the left, really paretic in the back end. You put your hand.
You should tell someone what proprioceptive deficits are.
Yeah, so not really knowing where their foot is in space and time, so poor placement and weak and sagging in the back end. And you put your hand on its back and you felt every lumbar vertebrae was, and I was like, oh my God, this dog has just been going, this is my job.
Yeah.
I walk around the farm, I'm your mate. And just got to that point where I'm not your mate anymore. I hurt too much.
Yeah.
They're amazing. We got loads of stuff happening over it in the comment section, but we're going to come to it, guys. I'm not going to ignore you. I'm just a bit too engrossed. I'm being selfish tonight. So well, where does it live? Is it going to be collar based or is it going to be limb based? How accessible is it going to be for, as you say, the average dog owner to put on their dog? How's it going to work?
Yeah, so the idea is that it's going to be extremely accessible. All of our research indicates that the collar is a very appropriate place for it, that we'll get a great readout on the collar. And so, you know, we can't get around the fact that, you know, not every dog wears a collar.
Yeah.
You know, we have to have some way of mounting it, although, you know, potentially the future could be an implantable.
Yes.
You know,
smaller and smaller until you can put it under the skin.
Yes, and so, you know, this technology could sit in something just the size of a microchip.
Yeah.
And I think, you know, that's a whole nother future we can talk about some other time, implantables. Yeah. But yeah, so it's going to be very easy to apply. Pop it on the collar, and as I said, you know, we're still trying to figure out: do we produce our own, or do we piggyback onto someone else's activity monitor with our technology?
Do you use? That was going to be my next question. Cam's always looking to work with other companies, and we try to stay away from therapeutics, be it supplements, food, or drugs. Try to stay away from it because we want to be seen as completely independent. But when it comes to monitoring products and stuff like that, we think, no, yeah, let's get behind that because that's going to help everybody. Are there companies that you currently use? They're kind of like Fitbit type products. Do you think they have a place?
So I'll answer the second part first. Yes, they do have a place.
Yeah.
I've used a lot, and I've used them under the situations of clinical research, which, you know, you really are testing these products. You know, can owners set them up at home? Do they continue to give a readout? We're testing how long they hold their charge, how waterproof they are, how robust they are. Do they continue to function, as well as do they provide a useful readout? So I think there are a lot of products that are good. One of the biggest problems, and I don't think anyone has really solved this, is the seamless integration of that product's readout into the health record.
Yeah.
Or presenting it in a way that both the owner and the veterinarian can easily access it and assimilate the information. Because going back to where we started earlier on, talking about, you know, if you add something to a veterinarian's plate, well, they've got to figure out how to incorporate this into the practice. The last thing you want is someone coming in with a readout on their phone that only the owner can access, that the veterinarian doesn't have access to. The veterinarian doesn't understand what the numbers mean, and there's no way of getting that into the medical record. Well, suddenly you're on a losing streak. And so part of what we'll be doing is making sure that the readout, the data, the information is going to be readily accessible, readily be able to be moved into practice management software, electronic medical records, and importantly, make sure that veterinarians and owners are both aware of both the technology and what it means.
Yeah.
I mean, you know, there are some of these activity monitor apps that will send owners alerts, and they can be pretty scary. Your dog may have heart disease. Whoa!
I know.
They go into the veterinarian, and the veterinarian has never heard of this technology, this app.
No,
because it's some little mom and pop company who haven't communicated to everyone what they're doing. So, you know, there are important hurdles we've got to make sure that we overcome.
Yeah. I think that's a really good take home for CAM followers, is that there is a lot of development in technology and availability online. There's lots of stuff online now, but it doesn't necessarily mean that it works effectively.
Right.
Data, that's something to be really scared of. And also, as you say, you know, what does it integrate well? Like, okay, where I'm working, we have stance analysis, gait analysis. We do Gulick, algometry, goniometry. We collect a huge amount of data. When I try and write a referral report for another veterinarian, I know that they just go, it's a huge amount of figures that they're like, I've got 2 minutes to read this before I see this client.
Sure.
This gives me nothing to me. And I don't know whether that is a significant improvement in joint angles since that dog was last seen. So what I'm trying to demonstrate is that we've got to make sure it's something universally accepted, isn't it?
Right. Yes. And yes, accepted and understood by everyone. I mean, I think, you know, as an owner, if you're going to buy into technology like this, you need to know that the readout you're getting is meaningful.
Yeah.
And that you can make decisions based on that in a way that's going to benefit your pet.
Yeah. Well, this is a good chance. After this evening, guys, you know, carry on thinking about this and give me your thoughts. So I work for a company called Linnaeus, and Linnaeus is owned by a company called Mars. And Mars actually is an amazing global company that owns Banfield, VCA, Blue Pearl.
Blue Pearl, that's right.
And another one.
A whole bunch of, yeah.
85,000 vets or something. It's obscene, the amount of vets that they employ. And they're looking at technology where, as you say, the vet will know that there's something wrong with the dog before the owner does. So there's going to be wearable technology integrated into a practice system that they will pick up on a dog that is not moving as much, you know, so therefore assumed to be sleeping more. And how would you feel as an owner to get a text message saying that your vet would like to have a word with you? I know that sounds daft. I'm like, whoa, that's a step in. Wow. I don't know how I'd feel if I got a text message when I'm walking the dog with Luna and it says, by the way, we would like to see you because there's something not right.
I actually think this is just a different version of how veterinary practice used to be.
Do you think?
No, I do. Okay, so let's just, you know, let's look at veterinary practice in a village setting. You can think James Herriot.
Yep.
The veterinarian there just kind of had their finger on the pulse of what was going on.
Yeah.
I remember growing up and seeing practice with veterinarians where they would just call up and say, "Hey, how's that cow doing?"
Yeah.
Or how is that dog doing? You know, just checking in. Okay.
Yeah.
And at the same by the same token, you know, the clients, the owners knew their veterinarian very well. They would stop him or her in the street, call them up. You know, there was easy communication. All we're doing here is we're just, you know, in a modern world, we're just using technology to facilitate that communication when we're all busy and we're all dispersed. You know, we're not all in this little village where we all know each other. We're much more dispersed. We're busy. We've got other distractions. And so we're simply using technology to recreate that relationship. That's all it is.
It's really true. And you're right. My first job was in Norfolk. And as you say, you did have clients that would come in for their annual and say, how's he doing? As if to say, right now, you summarize where my dog is in their life. What do I need to know? And yeah, no, that makes a lot of sense. I think also what I like about this idea with these technologies, though, is that we know that our owners are sourcing lots of products away from the vet practice, and that's fine, you know. But we do also know there's a lot of crap out there that people are buying into left, right, and centre. Can I just tell you my story? I'm telling everybody my story. My face was used to advertise someone's supplement recently. Photo.
Now you're talking about like a facial cream supplement or a...
No, joint supplement.
Oh, a joint supplement. Okay.
Yeah, we went to their website. We're like, and one of the girls said, Hannah, do you advocate this joint supplement? I was, no. And they went, well, they're using your photo and saying vet approved.
Yeah.
So, yes, guys, there's a lot of really dodgy deals out there and a lot of people making quick bucks. So for me, this technology is quite exciting to help people negotiate, because they're always going to buy things online. Is it actually working? I think that's quite exciting for me.
Yeah, no, yes. So that's what I'm doing. That's why I'm doing it.
Yeah, good job. Okay, so I'm going to do a little trick on you, a little game. We're going to pretend that you're back in a first opinion practice somewhere in Yorkshire.
Okay, great. And, could it be Lancashire? Do you think we could do Lancashire instead?
Lancashire's okay. We can do Lancashire. And we're going to put you through a bit of a simulation of a first opinion case. And so a lot of people that follow this page, you can relate to this. So Mavis has come to see you. Mavis is about 5 years old, and she's a body condition score of about 7 out of 9. And she's been really beginning to slow down. And Ethel, no Luna, Ethel, her owner, has come in and just said, oh, you know, she's getting a bit lazy and she doesn't really like doing the things we used to do before. You know, can you just check her out? What's going through your head and what sort of advice would you give? Luna, no. What would you?
Well, I think so. I think the first thing that comes to mind is I'm not going to jump to any conclusions. There's a lot of things that can cause dogs to slow down. Now, that said, the pain from osteoarthritis, the pain from arthritis is the most common cause of this slowing down.
Yeah.
But heart disease can do it. Other diseases can do it. Just being too heavy for your body, your muscles, your bones, that could do it. So there's a lot of things that we're going to need to look at. And I'm probably going to, as I chat to Ethel, I'm going to try and figure out a little bit of the history. So when did she start to see this? Are there any other signs that have been observed? Any coughing? Is this slowing down? Is this worse on exercise? Is there heavy breathing? Has Mavis been off her food? So all of these questions, which may seem, you know, just like kind of random questions to many people, these are all helping me build up my differential list. Because I'm coming into this. So as a veterinarian, I'm thinking, okay, I'm making some assumptions. This is probably arthritis.
Yes.
But I also want to think about heart disease, lung disease, cancers, other diseases. And as I'm asking these questions, it's almost like a little, you know, those flight schedules you see in the airport. I'm starting to move the diagnoses around, up and down. You know, so you know, maybe I say, you know, has there been any heavy breathing or any problems breathing? And Ethel says, oh yes, you know, the breathing sometimes is awful. Suddenly in my mind, I'm saying, oh, heart disease and lung disease going up to the top.
Yeah.
And then Ethel may say, yeah, you know, she has trouble breathing every time my son takes her for a run. I'm thinking, okay, let's drop those down. You know, it's probably that we're just pushing Mavis too hard. And so as a veterinarian, all these this is what I'm doing. I'm asking the questions, and then like on that flight schedule board, I just keep moving around the diagnoses until there's less movement. And as I'm asking the questions and also doing the evaluation, the examination, the hands-on part, I'm kind of settling out, and I think, okay, the most likely problem is X followed by Y. So I'll be asking these what may appear like random questions at the same time, examining Mavis. So listening to the heart, the lungs, running my hands over the body. I'm going to be assessing now, particularly because of my interest in pain and joint disease. I'm going to be assessing both the amount of muscle throughout the body and whether it's symmetrical. And if it's not symmetrical, where I'm seeing less muscle, because that can give me a clue as to particular joints that may be problematic. For example, if you stand behind a dog and you look at the back of their legs, if the back of their legs, kind of the back of our thigh muscle there, if the back of their legs looks kind of skinny, that could be an indicator of hip pain or lower back pain. And so, you know, as a veterinarian, as I'm running my hands over, I'm gathering this information. I'll also be assessing Mavis for sensitivity. So, and particularly if I'm thinking about joint pain that's maybe been there for a while, I want to know if there's excessive sensitivity, because that may play into my treatment plan. And then I'm also...
Let people know what you mean by that, because so describe what you do and what you see to make you think sensitivity.
Sure. So this is a fascinating thing about pain. The longer pain is present, the more attention the body pays to it, in a way that the signals are ramped up. Okay, and so what we talk about is a amplification of the signals and a facilitated throughput. What that means is the signals are more likely to get through to the brain. So the whole pain sensing system becomes hypersensitive. And what that results in is, as you're touching even just touching the skin or putting gentle pressure into the muscles, these animals will hyperreact. The skin will twitch and fasciculate. The muscles will tremor under your fingers. And so that's what I'm looking for. That's what I'm feeling for, is these signs of excessive sensitivity, which tell me about the pain status of that particular patient.
And I think that would be something I daydream of, is that owners understand that, and they maybe even be able to come in with that kind of information as well, because quite often dogs in the don't allow you as much information as you'd like. And if people did come to me and say, do you know, he really doesn't like his back end being touched anymore.
Right. Yes.
That would be so helpful. Okay, so carry on. So you've done your palpation. Yeah,
so it's at the moment it's a general, feeling for that muscle mass, which is so important, and also while I'm doing that, I'm also assessing how Mavis is standing. Is Mavis leaning forward? Is the back rounded? I mean, it's just a little thing like that. Okay, so let's just talk about this. Dogs are not supposed to have rounded backs.
No.
Dogs are supposed to have flat backs.
Yeah.
Actually, they're supposed to have a little bit of lordosis, a little bit of a dip in the back.
Yeah.
So if you see dogs with rounded backs, what that means is that they are working hard to adopt an abnormal stance. And dogs don't do that just for the heck of it. They do it because they're driven to do it. So if you see a dog with a rounded back, it means it's being driven to adopt that position, most usually because of pain. So I'm looking for how they're standing, how they're positioned, how they sit down, stand up, how they sit, lie, all of those sorts of things. So these are all playing into the picture I'm building of where a potential pain problem might be and what the impact is on that particular patient. I'm trying to sort of, assess those things.
So there's a little bit of an emotional, what impact is it having on that dog? So, you're understanding a bit of a global overview as well as a focal pain. Yeah.
Absolutely. And that, yes, thanks for bringing that up, because so often when I'm talking about joint disease, arthritis, everyone starts thinking of the joint.
Yeah.
The joint, the single joint or two joints in the periphery. And the reality is, and actually you explained this really nicely on your website, I think, the impact, yes, I think so. The impact of local joint pain is actually on the whole body.
Yes.
It maybe affects one joint, one leg, but then because of the effect on the leg, you alter the way you move and stand and sit. And so you get these global effects.
Yeah.
And it's really important to know, particularly from a treatment perspective, what is the impact of arthritis on the whole pet?
Yes.
Now, we're assuming in Mavis this is arthritis. A whole conversation here, but I'm always thinking,
wasn't it? If I took
I know, but I'm always thinking,
you were wrong.
You're always thinking, okay, there may be something else. And so as I'm going through this evaluation, I'm keeping my.
It's not a trick.
Now, that said, if I think, okay, possibility of there being arthritis present, by this point, for Mavis, in this first opinion practice, I will have maybe had so many clues that the back legs are affected that rather than going through every single joint in the body, which is good to do, I'm going to be efficient with my time, and I'm going to focus on the back legs. And actually, because of running my hands over Mavis, I'm pretty certain the stifles, the knees, are good. Yeah. And the hocks, the ankles are good. But I know there's a back leg problem, so I'm going to focus right in on the hips.
Yeah.
And so that's how I kind of, do the evaluations. if I have the time, I'll go through absolutely everything.
Yeah,
But,
time constraint is such a problem, and I hope
right.
in my lifetime that OA gets elevated to being a disease that warrants a half an hour appointment minimum. We're forced to work 10 to 15 minutes, and there's certain diseases that have almost been given a little bit of a elevated status, and they will be given more time. So like diabetes, they're longer consultations because it's a bit more complex and stuff. No, OA deserves more time. I hope that.
And I spend a lot of time talking to veterinarians about how your gait evaluation is done between the waiting room and the consult room. That every time, every second you're with that pet, you're watching how it stands, sits, moves. That's useful information. And then what I've just talked about, you're running your hands over, means you can really then end up focusing on evaluation and being really efficient about it. And so I have created these videos. An orthopedic examination can be done in just a full orthopedic examination can be done in a few minutes.
Brilliant. Well, I might get you to do that for the camp people to see.
All
What
right.
we were thinking about as well, we don't know how long this COVID crisis is going to go on. And one of the videos we were going to do for camp followers is starting to teach them how to examine their own dog. So if we are still forced to be phone consults and emergency only, it would be very useful for owners to say, well, I've checked nails, I've checked pads, I've checked toes, I've manipulated his calf, his wrist. He's actually not flexing very well for his elbow, and he kind of pulls away from me then. How helpful would that be? But it's always making sure that we don't stand on vets' toes. We don't want to offend anybody, but we thought that'd be quite useful.
Yeah, I think that's a good idea, and I think also what that's going to do, that's going to help owners look at their pet in a slightly different way, maybe more carefully. I've been amazed in my clinical research how when even just asking owners to complete questionnaires, they start watching their pet more closely. They understand more about the pet. They learn more about their pet.
Yeah. Well, we found that a lot of vets are seeing that people are now noticing things in their dogs that have probably been there for years, but they're stuck in socket for a few weeks now. And they're like, he's got a lump. No, that was there 3 years ago.
Yes.
A little aside, do you find it really difficult not to say things to friends and neighbours and family when they come around with their dog? Do people leave their dogs at home now, just in case you find things wrong with them?
I haven't noticed people leaving their dogs at home. I have two sort of sets of friends. The friends that come round because they think there may be a problem or they want me to check something out.
Yeah.
And then the friends that come around that really maybe I've learned to be a little bit careful about what I say.
Yes.
Like as the dog walks up, I don't immediately say, "Whoa, what a problem," because it's just interacting with different people. Not everyone wants to be told there's a problem. No. But most people actually do want to know. It's just how you get to that point. It's just how you have that conversation. Some people just need to be gently opened up to it. Other people just want to know. Just tell me.
And I think that is something like the lovely James Hunt was on last night, and he was saying we need to do a big congress about OA. So that's when I first met you, was at ESVOT, when you did a focus on OA on one of the satellite days. I think it was 2016.
Yes, yeah.
It was a long time ago. And so at the end of the Facebook Live yesterday, he was like, we need to do a congress. We need to do a really big thing all about arthritis. And we need to have different streams going on. And one of those streams does need to be communication. And it needs to be giving the vet or the vet nurse or the therapist the tools, the mental tools of going, how am I going to engage with you and get the best out of you? And how am I going to give the best of me to you? How can we work together on this? Because every client is very different. And there's been some times that I've had people come in and I'm like, I'm not going to win this one. And they are the ones that take my advice and they do it to the T. And you're like, holy moly. That happened just before Christmas. I had a guy that you knew that he fed his dog takeaways, and you knew that they had that kind of quite lazy lifestyle. And there was no way in the world that I was expecting that dog to lose weight. And over Christmas, over about 2 weeks, he got 4 kilos off his Akita. So it was a 48 a kilo Akita, and it needed to be about 38. And he came back in the new year, and I was like, I would have put money on you ignoring everything I said. It is fascinating being a vet because you aren't just treating the animal, you're really trying to engage with the owner. We've been talking for ages, but there's a couple of things that I want to talk about. There's new things happening, and I know they're not available yet, and I'm springing this on you. But I get a bit frustrated that people say, oh, it's boring, it's so boring. When we've got things like monoclonal antibodies, you know, holy crap. You know, we've got some really massive progression in the pain field. Can you just kind of blow the camfollowers away and just talk about some of the things that are coming our way, hopefully in the next 5 years, maybe?
Yeah, absolutely. So you talked about monoclonal antibodies. So these fall under the family of biologics. Yeah. So when you're thinking about therapeutics, they tend to fall into two camps: what are called small molecules, which are like exactly what they are, small molecules, versus the biologics that are proteins, peptides. So when we're talking about the monoclonal antibodies, we're talking about biologics, so the little peptides, proteins. And this is really exciting. Up until recently, producing monoclonal antibodies has been really difficult and therefore really expensive.
Yeah.
And on top of that, you have to make them species specific. So, for example, you know, if anyone listening is on a biologic, a monoclonal antibody, you could probably give that to an animal for the same disease and see some sort of efficacy, maybe. But that animal is going to create antibodies against that foreign protein, because that was a human therapeutic, against that foreign protein. So the next time you try and use it, it no longer works. So that's a long-winded way of saying that when you're giving these protein therapeutics to animals, they need to be species specific. So suddenly now we've got to the point where technology has advanced. We can make species specific monoclonal antibodies for cats and dogs. And in the pain world, so there's already been one on the market for itch, an IL-31 monoclonal antibody. And in the pain world, we're very shortly, I would say in the next year, 18 months, going to see products available to mop up something called nerve growth factor. So just a quick aside. So nerve growth factor is a really important driver of chronic pain, particularly for joint disease. And what the monoclonal antibodies will do is they'll be injected, absorbed, and they will bind to the nerve. So the little monoclonal antibody will come along, bind to the nerve growth factor, and stop the nerve growth factor having its effects in producing pain. Now, your listeners may say, well, how different is that from a daily pill? Well, the difference is with these monoclonal antibodies, they'll be injectable, and the effect will probably last for somewhere between 4 and 8 weeks. Really good pain relief. And so far, we haven't seen any adverse effects on organ function. So
this
is great. Okay, so we're getting a new method of pain relief. We're getting long-acting pain relief, and we're not getting any adverse effects on organ function. And so I think, and particularly for certain pets, for certain pet owner combinations that don't want to be giving daily medication, this is going to be a huge step forward. I mean, just think about cats, not having to pill a cat.
So is it going to be part of a multimodal, like it's common for us using cats as an example to be like, right, so we're on the Metacam, where do we go now? This cat's still painful. Okay, let's add amantadine, or let's add. Is it part of it, or do you feel that it's going to be having such a strong effect it will be able to work more as a sole agent?
Yeah, so I was involved in some of the clinical studies a few years ago, some of the first clinical studies, and I was pretty impressed with the efficacy. So I think for a lot of patients, this is going to be the only therapeutic that's needed. That's not to say that we're not going to be thinking about exercise modulation, weight modulation, dietary modulation, and so on. So those, yes, so we're still going to be doing a multimodal approach. But I think when it comes to therapeutics, that maybe for many of these patients, that'll be the only therapeutic that'll be needed. But for others, we will be adding on other therapeutics as needed. Yeah.
Yeah, that's very
But this is so, and I forgot to say, so this is really exciting. We've already seen in veterinary medicine a new class of analgesic that's not even available in human medicine. That came out a couple of years ago. That's the grapiprant, the EP4 receptor antagonist.
Is that not available in humans? I didn't realise.
No, and the monoclonal antibodies against nerve growth factor will probably be available in pets, for pets, before they're available for humans.
Okay.
And this is just, you know, a product of the fact that there's a lot of innovation in veterinary medicine, a lot of innovation in pain management, and because technology is moving ahead, we can now create these products, or you know, not me, but people can create these products at a very cost-effective way.
Yeah, I do know that somebody I was talking to was saying, is it going to be a problem because it has no disease modulating effect? So by removing the pain, which is a big part of the arthritis syndrome, but do we know enough about what continues to happen in the joint?
So that's a great question. I think it's important just to set the scene here.
Yeah.
We don't have anything that modulates the disease at the moment.
Yeah.
Period.
Yeah.
So, you know, to criticize a new analgesic on the fact that it doesn't modulate disease is a little bit disingenuous, because we don't have anything that does that anyway. Okay. Yeah. But also, I think what many people forget is by treating pain, if you treat pain, you actually decrease progression of disease in a small way, but you do decrease the progression of disease. For example, using these monoclonal antibodies against nerve growth factor, using other anti-inflammatories, decreases the sensitivity of nerves and decreases the contribution of nerves to local inflammation and disease. So, you know, I don't think we should be thinking of things as just analgesics and just disease modulating. There is crossover, but it's also important to remember that we don't have anything with a proven ability to modulate the progression of disease except for decreased caloric intake.
Oh, I love it. We're going to say,
and so there are really bright people all over the world who are trying to develop drugs, therapeutics, that decrease the progression of osteoarthritis. And I really hope that some of these can be successful. But at the moment, we know what has a dramatic effect on disease progression, huge effect, massive, phenomenal effect at decreasing disease progression. And that's keeping your dog slim for its life.
And for some reason, it just seems to be not important.
Yeah, I mean, you're talking about a 75 to 80% reduction in the amount of osteoarthritis. And that's, you know, and, you know, maybe my colleagues would argue with the exact figures there and what that means. But from a high level perspective, you're talking about a huge reduction in the amount of arthritis if you can keep your dog slim.
No, I think we're for any CAM followers that are listening, we're doing free body condition score, visual body condition scoring in Holly's Army. So as soon as you join our little community group, if you would like, you can send in photo of your dog from above and from the side, and you email it to us, so it's all private, so you don't have to have any kind of shame. Not that there would ever be shame, but a couple of our team look at the photos and they give you their feelings on your dog's body shape and whether you need to go and see your vet practice, your nurse, etc., for further support. So yeah, that service is there. Please take advantage of it, because as Duncan was saying, weight is just so important. Next one, this side, Cinna Beacon. What's going on there? Because that's just like James Bond, really, isn't it?
Right. So this is a radionucleotide that can be given into joints, and cutting a long story short, it'll decrease what's called synovitis.
Yeah.
So let's just back up a little bit. in every joint is lined by something called synovium. And when you have arthritis, when you have osteoarthritis, that synovium, the lining of the joint, gets inflamed. And that inflammation of the synovium plays a role in not only the production of pain, but also the progression of disease in that joint. And so the idea here is if you can decrease the synovitis, you'll decrease pain and potentially also decrease progression of disease. So it's exciting therapeutic from that perspective. It's also exciting, and there are all sorts of other exciting therapeutics I want to talk about if we have time. But one thing that we need to do more of is think about local treatment.
Yeah.
So so often we get focused on systemic treatment, the pills, the injections, and for certain patients those are absolutely appropriate. But this is a local treatment, so this is put into a single joint. And that is needed because, or therapeutics that are given locally are needed because many dogs have just one or two joints that are problematic.
Yes.
And so I think this is exciting because it's a novel way of treating. It's addressing synovitis, but it's also a local treatment.
Yeah, and has it been used in humans? Like, this was years ago. I contacted Stephen Fox in like 2000
right.
something, and he alluded to the fact that he was working on it, and there was something about in Europe, it was being used on people. But have we got much evidence about longevity studies and stuff, or are we still in its infancy?
Yeah, we have a relatively little information in veterinary medicine. We can certainly draw on the human experience. But I believe that they're doing a great job of creating more data, more information. So we'll have a much better idea of both when it's appropriate to use it and how long we see the effects for. Because as I mentioned earlier, not every treatment is right for every patient.
No.
And what we really want are good data on how do we as veterinarians make that decision? If you have Mavis in front of us, well, what is going to be the best thing for Mavis?
Yeah, and the best thing for Ethel as well, in that the owner,
that's the point. Yes.
Very, very part of the treatment plan. So when we are trying to teach nurses stuff, we say it's not just a disease of the joint, it's not just a disease of the dog, it's also a disease that affects the owner both emotionally, physically and financially. And it does. I often tell people that I spent $3,500 on the last month of Holly's life. It just poured out because I was trying anything. You go into this emotional kind of, this isn't, I'm not ready yet, and I don't want her to go yet. And we've got to try something else because the brain was still there, the body was still there, but the joints and the pain were taking over. And there's so many people that are in that same boat where they're saying goodbye to their dog and everything up to top is still fine. Oh, it gets me very upset. So tell us what else is going on. Yeah, come on.
Just following up on that though, because that's such a tough time for everyone, we know how to make that a less tough time. We're going to act earlier.
Yes, we are.
So these young dogs, we're going to keep them slim. We're going to keep up regular exercise. It doesn't mean to say 10-mile walks every day. Just keep our pets moving. That's good. That's going to be so good. And if we see signs of pain, that's when you've got to act quickly, talk to your veterinarian, get the appropriate treatment. Think of it as kind of a treatment plan for a defined period of time, and then you're going to back off these treatments. Keep everything in check. Keep on top of the problem so that at the end of these pets' lives, the problem's not out of control.
Yeah, and I think collectively, both vet and owner, if we've got a dog that's pulling up lame, twice a year, same limb, it's not coincidental kind of soft tissue injury. Go look, find out what's underlying it. And I look back on my previous years and no disrespect to my teaching at uni, I just didn't get equipped to think like I do now, which is, as you say, catch it early and find out where the pain is, but also be able to have a confident conversation with that owner and say, I know it's only the third time you've seen them lame, and it's probably quite subtle, and your dog's still having an amazing life, but this we do need to take quite seriously, and we need to find out what it is. So we've got 10 years ahead.
Yeah, yeah. So talking about that, let me turn the tables a little bit here. So you've got a great set of resources on your website.
Mm-hmm.
What have you found people are most interested in or find most useful?
I won't lie, I find that people go straight in for the kill of wanting a fix rather than wanting an education to understand where the fix. So we'll find that people will go straight to the supplement section, or they'll go straight to how do I manage it, and they tend to focus sadly on drugs and interventions.
Right.
And it does frustrate me terribly, because it's only by understanding more about the disease do people realize where all the freebies come in. So you probably know I'm obsessed about flooring. I'm obsessed about further injuries, and they're no-brainers to me. And when you understand the disease, the progression, the global effect it has on the body, you can understand how these further injuries happen. And we had Paul Ibrahim on about a week at painscience.com, and he called it collateral injuries. And he was like, well, every musculoskeletal injury, you will have collateral injuries, because you lose those subtle abilities to correct posture, to adjust balance instantaneously, to prevent further, twists, turns. And if only people were willing to listen to what OA does, it's not just about the joint. If we really understood about the impact it has on the dog physically and emotionally, those freebies, the licky mats, the Kongs, the snuffle mats, the scatter feeding, the rugs on the floor, they're all free and they have a massive impact. And I just wish people would go into, we've got a YouTube channel now, so we put all of these Facebook Lives on YouTube. Go in, learn about the disease, because then you'll be empowered to embrace the foundational. And then all of these new novel treatments, they're part of it, but they're not all of it. If that makes sense.
Yeah, no, it's all together. And I love your obsession with flooring. That's great.
I am obsessed.
And it's really important. And, we can talk a little bit about the rationale behind it. So when you have joint pain, if you have if you're moving on a surface where there are going to be unpredictable movements, that means your joint pain is going to be even worse.
Yeah.
And so very quickly, these pets end up with a fear of moving because of the surface.
Yep.
And a fear of moving means you move less. Moving less means the joint pain is going to get worse. The muscles are going to lose their condition. There's less support for less support for joints, and you have this downward spiral. So you change the surface of the floor, you remove that fear of moving, you facilitate moving, and it may not seem like much, but just walking around a room is movement. And that's useful, and that's beneficial. So
useful. And it's there is definitely a little bit of an issue between public and vets. We seem to be loved and hated very quickly, and it's always financially based. And this intervention is a free, absolute game changer. And I wish that more people were promoting it. And I wish the public were more accepting of it. But there is a focus on pots and pills, whether that be supplements or actual medication. There's some obsession with pill popping, isn't there? And I think
that's just our modern society. We want a quick fix rather than to really think about what the root of the problem is and to make lifestyle changes. And I think what we're talking about here is you need to do both. You need to be open to both. Lifestyle changes are really important. But if you just think about it, so I mentioned movement. Exercise is really important. But the reality is, if you're painful, you have trouble moving and exercising. And so, I use therapeutics to facilitate movement. Movement results in its own pain relief.
Yes.
And so you end up eventually with less pain to manage, so you can then stop the therapeutic. I hope that makes sense to people. So pain, and maybe we should talk a little bit about this. So pain is dynamic. Okay. So earlier on this evening, I talked about the fact that if you leave pain untreated, the system ramps up.
Yeah.
Okay, pain becomes greater and greater, the sensitivity starts to appear, hypersensitivity develops. So that's the pain transmission system deteriorating in one direction. But also, what that means is that if you treat, it can move back towards normal.
Yeah.
And
yeah.
so pain treatment should be dynamic. Pain management should consist of dynamic treatments. What that means is you start a set of treatments, reevaluate, you start to pull treatments out and see whether you can maintain efficacy. So that's really, why.
And it's hard. It's really hard. Like, I do nothing but arthritis and musculoskeletal management now, and it's hard to communicate and to assess and to slightly adjust. And can I get better? Have we seen a little deterioration? Do I act now and change this, or is it going to come out of this curve and I don't need to change anything? This is just a little cyclical dip. It's very hard work, and it involves really good communication with your owner and having a really good rapport. I love what I do, but it is quite taxing. There's so much I want to talk to you about. I feel like I've had like a really, really, really good Friday. So yay. Is there other stuff that you want to kind of say, or do you want to come back and share more knowledge? I think that would be amazing.
I'd love to come back sometime. What I can say is pain management is a really exciting place to be in at the moment. There's a lot happening. There's a lot happening in terms of diets, a lot happening in terms of novel non-drug therapeutics.
Have you got
a lot happening in terms of therapeutics. I mean, it is exciting, and the future is bright. We got to fix a few things about how we talk about pain, how we think about certain diseases. We talk about osteoarthritis being a young dog disease, but that's all going to become easier as we know more about what works to alleviate that pain.
Yeah. Do take the opportunity to talk about diet. It's always a motive. Sure. So I am going to put a little bit of, I always want to put earmuffs on, because diet is such an emotional topic when we're dealing with dog owners. Where do you sit? What are you saying that diet has its influence? Explain.
Yeah, so I think within reason, I don't mind what people feed their dogs at all. Now, I am not a fan, for some very good reasons, of the raw diets. Okay. I think if you're doing a home cooked diets, you just have to think very carefully about making sure they are balanced. Mm-hmm. I am not saying that the commercial diets are perfect by any means. No. But essentially what I'm saying is I don't mind what you feed your dog, but there are two things that we really do know. One is that calorie restriction is good. Yeah. And what that means is just keeping your dog slim. It's good. It's good for the joints. It prevents osteoarthritis. It decreases the incidence of cancer and other diseases. So calorie restriction, even though none of us want to talk about it, none of us as individuals want to do it. We certainly don't want to impose it on our pets. But the harsh reality is it's good. Okay. So that's important. And I don't pay any attention to people who say, oh, the bag or the box or whatever says I should be feeding 2 cups a day or a certain number of grams. I don't care. It's how your dog looks. If your dog is carrying too much weight, you need to feed it less. It doesn't matter what the packet said. Okay. So the first thing is the amount of food that pets get. That's really important. The second thing is that, and when we're talking about arthritis, the one thing that makes a difference to pain and inflammation are the omega-3 fatty acids. Right. So if those are in the diet in certain quantities, you will see a detectable difference in terms of pain and inflammation.
Right. Okay, so that's good. And that is a globally accepted thing. So every guest that we have on here, and it's not a setup, guys. I don't go, so I want to have your feelings on omega-3s before I allow you to go live. Never. People are allowed to say exactly what they feel on these lives. And you can see, guys, every single time that is said. And it is globally understood and accepted. Marine-based omega-3.
Yes. Yeah, and I think now, we can get into the nuances of this. It's omega-3 fatty acids, ideally marine-based, and then as we move out, there's emerging evidence that not just the quantity of omega-3 fatty acids, but maybe the quality, certain omega-3 fatty acids that are sourced from, that are marine-based, have beneficial effects as well. Now, diets come in all sorts of different types and flavors and components and constituents and so on and so forth, but it's those two things that are really important. Think about marine-based oils, and whether the diet has those added, and think about the amount that you're feeding your pet.
Yeah, no, absolutely.
I am not a nutritionist.
No, I'm not either.
That's where I come from, and because those two things are really important. Now, if you're talking about a metabolically unstable pet, a pet that's really sick, you should be talking to a nutritionalist or a veterinarian who has a good understanding to make sure that the diet is appropriate for that particular pet.
Yeah. And I think people get a bit frustrated because there is so much out there now, and there's so much marketing. And the reason that it's effective. We are suckers for marketing. That's why it works. They tune into what we are vulnerable to, and the wording and the phrasing and the color schemes and stuff. And I went into pet time. I try and avoid going into pet shops because I just get terrified. But I did for UCAM followers, and I was like, oh my God, I have no idea. There's just so much here, and all very persuasive. But we hopefully are trying to get a board certified nutritionist to join the CAM team, to be there to answer these questions with no bias, no fingers in pies, no vested interest, but somebody that's going to really stick to, fact. What do we know to help you guys, wade your way through? But for the people that, feel a little bit guilty, like sometimes I feel guilty because I feed Luna a very well respected kibble diet, and she has a baked wet food, and it's mixed together, and I'm a busy person, and sometimes when you read stuff and you go, oh God, should I be doing more? And then I have the other part of my brain go, no, Hannah, it's a very sensible, it's respected, it's clinically balanced diet. Put that worry away. If anybody on here is going, oh God, I've been worrying about what I should feed my dog, don't get sucked into feeling too guilty about it. I feel very strongly about that.
And also I think, so that guilt can often result in doing extreme things. And I think, once you start to be on the extremes of creating diets or the diets that you feed your dog, those start to become dangerous. When you go to the extremes of adding in supplements at very high levels, when you go to the extremes of a raw diet, a meat-only diet, on the other side of the coin, a grain-free diet, these are extremes that are not good.
Yeah, no, I think that's a really wise statement. Thank you for going into nutrition a bit. It's such a contentious topic.
Oh, I know. And the reality is, it's sort of within that big, huge middle ground. It doesn't matter what you feed your pet.
No, I'm going to go
as long as it's a good, balanced diet, and change things up.
Yeah, if your system likes it. But yeah,
yes, it's true. It's true.
Luna's a very exciting life. Right, we're going to do 10 top tips, and then I'm going to let you go because seriously, I have looked forward to this for ages.
Well, likewise, and thank you for having me on.
It's awesome. Okay, so we're going to do 10 top tips, guys. We do this to make sure that anybody that's been listening, it doesn't matter your financial background, it doesn't matter your physical capabilities, these are core game changers that we really want you to understand. Number 10, you're number 9, 8, 7, 6. Okay, so number 10.
Okay. And these are tips for what?
They're tips for management. So they're just basically things you've learned on your journey that you think, I wish they'd know that, and take that with them. And they're generally quite generic advice. Yeah.
Okay.
So, I'm going to steal weight because we've spent a while there. Do this every time. So Banfield Hospitals, they did the survey. 9 out of 10 owners can't see that their dogs are overweight. So 9 out of 10 owners of overweight dogs can't see it, which means there's a really big possibility that the guys listening to this, you don't realise your dog's fat. And we see this a lot. So when people come into Holly's Army in their first photo and everybody says, hey, it's great to meet you. And I'm sitting there going, can I tell her? Can I tell her? Be cruel to be kind. Take your eyeballs out, put them back in, look at your dog, pretend it's not yours, and be honest with yourself. It's really, really important weight control. Number 9.
Exercise. And we're gonna start by just saying, and we maybe further down this list we'll get into the amounts and so on.
Yeah.
But our number 9 here is just move. Get your pet to move. And so as a starting point, have some movement with your pet twice a day.
Like it.
Like morning time, evening time, just some movement.
Yes, I like that one. I'm gonna steal a little bit of that. As you say, some movement. It can be quite sad times looking after a dog that is sometimes struggling. So look after yourself as well by engaging these movements in things that make you smile. So when Holly was less able, putting kibble in bits of paper in a box and looking at her moving around, trying to work out how to get it out, using the licky mats, using the Kongs on a non-slip surface, she had a great time. She was less able, but she was moving and she had all these brilliant neurochemicals going off, and I felt better because my dog was in a good place. So take advantage of interactive toys. Number 7.
Oh, that was number 8 for you, interactive toys?
Yeah.
Okay, all right.
Number 7.
All right, so number 7, I'm going to jump around a little bit here, and I'm going to say, if it's appropriate for your pet to be on some sort of therapeutic, consider giving it consistently rather than this as needed. Okay.
I like
that. So, and this comes back to what we talked about this evening about the fact that the pain transmission system gets wound up and it needs time to wind back down. And that will not happen if you give a medication intermittently, once a week, once every couple of weeks, for 2 days every couple of weeks. And this is something to talk to your veterinarian about. But just, that's our number. I forget if it was 7 or 8.
Number 7.
7.
Yes.
We're going to think about consistent medication. That does not mean lifelong, just consistent.
Yes. Number 6 for me comes from a phone call last week, I think 3, where introducing the idea of multimodal therapeutics, so multimodal pharmacologicals. And you could hear the people's breath go at the end of the phone of, what, more than one drug? Oh my God, that's just, no, they work in different places. Be confident that a multimodal pharmacological approach, if required, they've thought out. These drugs are working in different places. They're not all kind of stockpiling on top of each other and going to cause a massive problem. They're working on different parts of the pain pathway. So have faith. Number 5.
Omega-3 fatty acids or marine-based oils. Ooh. Enough said.
Enough said. I know. Well, you can say. I'm not going
to. Consider adding those in. There, now there is an expense involved, and this is where you have to get a little bit smart. You have to do your research. Yeah. And so if you're going to add these into the diet, say you have a preferred diet for your dog, that's fine, but you want to add these in, and you should consider if your dog has arthritis pain, because they do work. Okay. Make sure it's a reputable brand. And one way of telling a reputable brand is if that company does what's called third-party testing.
Right.
So what that means is they send their product out to a completely separate company that tests it to make sure that you're getting what the company says you're getting in terms of amounts, and that there are no contaminants or anything else in there. So third-party testing, and then look very carefully at the different brands and the amount of omega-3s that your veterinarian is recommending, and try not 20 capsules. So look at the content per capsule. So just be smart about it.
So do you have a figure? Because it's spun all around the internet. You know, people are saying different things, and it's anywhere between like 100 and 175 milligrams per kilogram of EPA, DHA, ETA.
Right.
And people are struggling with this.
Yeah.
Cam really annoys them because we don't go, just get that one. We kind of say, right, so these are the figures that we try to encourage you to do. I think it's a 5-to-1 ratio of omega-6 to omega-3, and that's really complicated for a normal public. Do you have figures that you?
Yes, it can get very complicated very quickly. So I like to start off at the level of okay, try and add in at least 100 milligrams per kilogram per day. Somewhere between 100 and 200. So that's where you pitch in terms of number of milligrams of total omega-3 fatty acids.
Right. Perfect.
And then stop there. Because if you use a reputable brand, you'll get the appropriate ratios of DHA and EPA. And when you add those omega-3 fatty acids into a diet, you're going to improve the N3, N6 ratio. So I try not to overthink it. Because I think then, things don't really always work out.
No, it is. What I do find funny though, and this is just very
right,
put more energy into thinking about our dogs than we do ourselves. I'm probably not going to eat a balanced meal tonight. I'm probably going to drink rather than food, but do kind of have a disproportionate passion for what our dogs eat than what we do for ourselves, don't we?
Now, what are you going to drink tonight?
Oh, gin.
Oh, okay, all right. That's supposed to be okay.
With tonic.
Right. So you've got yes, okay. You got everything covered.
It's Good Friday. I've got a bit of lime.
Yes.
That'll be all right. Right. Okay. Cool. So talking about taking your eyeballs out and putting them back in and looking at your dog differently, please look at your house differently. Everybody is at home at the moment. Everybody's doing DIY. Everybody has decided that they're going to pull their wardrobes out, move their beds around, got time to kill. Just think about the change in environment. And we spent some time talking about flooring, and I've seen it so many times where dogs come in and they see me as their first opinion vet, and I dig a bit deeper and something's changed. It might be that somebody came to stay and they did loads more dog walking because that person had never been to that village before, so they went to that pub and they went to that shop and they went to blah, and the dog overdid it. Or something in the house has changed and the dog is now slipping and stumbling and falling. So please look at your house with fresh eyes. Number 3.
Okay, number 3 is going to be young. Okay, so that's just number 3 is young. In relation to osteoarthritis is a young dog disease, and that's okay. It's okay to embrace that, because if, as an owner of a young dog, you embrace the idea your pet may have osteoarthritis, may be prone to osteoarthritis, by tackling it now, you can improve your pet's future dramatically. And it's and I think the opposite of burying your head in the sand and trying to ignore it until your pet is much older, that's the wrong way to go, because then the problem is so difficult to manage. So think osteoarthritis, young dog disease.
Yeah, 100%. Number 2. Yes. On that note, let's start talking about arthritis and pain earlier, in that puppy classes and people that have influence, be them dog trainers, behaviorists, nurses, and first vaccines, second vaccines, we do need to start equipping people with the tools to understand identifying signs of pain. And I think at that point, owners are very receptive because they come in and go, I just want the best thing for my puppy. He's brand new. I want him to, you know, remain safe and grow up well. And we should introduce the idea that pain will occur in this dog's life at some point, and I want you to be there and able to identify it early. So number one.
All right, so many things we could continue to talk about. You know, the benefits of massage therapy at home, being open to therapeutics. But I think my number one is just talk to your veterinarian.
Yeah.
Have a conversation. Your veterinarian wants to help. Talk to them and make this a team approach. You, your veterinarian, the practice staff, this is a team approach. And if you start talking to your veterinarian, you'll find them giving you advice about, you know, as we've talked about tonight, what you can alter in the home to make things easier. Dietary advice, exercise advice, as well as the appropriate use of therapeutics. All those things combined together. But your best source of information is your veterinarian.
Yeah.
So use that portal.
Love it. I think that's a very good 10 top tips. I'm very proud of ourselves.
All right.
Thank you. I've had.
You're very welcome.
I really, really have. I'm so grateful that you've given us your time because he's such a busy man. Such a busy man.
Well, this was an absolute pleasure. You are doing a fabulous job with the resources you're creating and the passion with which you're disseminating information. So important.
Yeah, and I have to put my hands up to the CAM team. There's a lovely team of women from all over the UK and the globe now. Most of us have never met, and we all converse by WhatsApp, instant messenger, and email. And all of them are working their absolute socks off to create this stuff. So there's probably 20 to 30 of us at any one point making this happen. So CAM team, thank you so much. You're awesome, awesome people.
Great job, everyone.
Yay! You're going to come back because we're going to have so many people say, this was amazing.
I would be delighted to come back. And I'm just going to say happy Easter to everyone. I know it's it's a really odd time in everyone's lives, but I hope you do find some happiness this Easter. Take care.
Yeah, and have a really good Easter yourself. I'm going to say goodbye. We will both disappear. Thank you very, very much.
Very welcome. Bye, Dad.